they've got a couple of slides that they were speaking to that. I'm definitely sure that they can take it into pieces in terms of the process and the impact. And then on the, from Honorable Khobane, on the source of the poor quality of the financial statements. And then, if I hear you correct, and I share the same sentiment with you, in PFMA, we should not have problems with the quality of financials. The modified cash standards are most easier, if I can say I'm comparing them with the municipalities that they have to comply with GRAP. That one is a more complex, but with the departments it's a very straightforward, because with department, with the cash standard, it actually means you just report of what you spent. It's not like the complexities with GRAP where you have to make accruals and all those complicated way of reporting where you have to depreciate your assets. So you don't have those things in provincial departments. But what we find is, because the issue of the cash standard is starting to evolve, to close the gap between the cash standard and the GRAP in terms of the accrual basis, there are things that needs to be disclosed in the financial statements. So some of the area that we see that the department are not paying attention is the cash flow statement, which is a very critical statement, because you are able to see what they receive and how do they spend. So we're starting to see that they are not paying attention to it. There are other disclosures that they need to make in the financial statements, which they don't do. So you see that it's not the things that are happening every day, but it's the things that are happening to be in compliance with the preparation of the financial statements, like those disclosures as well as the cash flow statement. Also, we do see that we have material adjustments that they have to make on both current assets as well as the non-current assets. So is if I can summarize, I can just say, is the discipline, and as well as the lack of consequences when these matters keep on coming up. So I think the provincial, the PFMA, we should not tolerate any material misstatements on the financial statements because of the framework that they are using. Then on the question around the role of OTP, the capacity, sometimes we try to not to allow them to make excuses about capacity. The departments have pressures already on COE. And when we come up with the recommendations and say appoint more people, we don't always see it translating to the results that we want to see. Rather, our focus is on those people that are there, even if it's one, even if it's two, are they doing what they're supposed to do? And the mandate of the department is very clear, that as the leading role or monitoring role that they have, they need to look at the APPs and review those APPs. So I haven't spent much to see how many people that are there, but I will say we need to, when we interrogate to them, we need to get them to demonstrate with the people that are there in those units, are they doing what they're supposed to do? I fully agree with you, Honorable Chair, that if we are not monitoring the role that we do, we are exposed to a risk of duplication. I remember also in one of the engagements that we have with Premier, we did raise these matters. The Office of the Premier has got a unit that is called special, I don't know whether it's special project or special something, but it's something that is we're starting with special, but it's I don't know.
Special programs.
Special, yeah, I think it's special programs. Yes, I know it's got something to do with special. No, it's not a special one. Yes, it's not. It's not. So when we're engaging with her, we raise that concern that if we are not clear in terms of the roles and the responsibilities, we are bound to duplicate the efforts. So I think it's something that I'm glad that you also observed that, and I think it's something that we need to, even when we're looking at the budgets, it's something that we need to interrogate even deeper as to if you are going to drive these projects, what is it that you are doing and how does it differ, how is it different from the role that is entrusted to the different departments that is there. So the risk of duplication is definitely there. Then the departments with the overdraft, I see that the overdraft in total is about 2.2 billion that we have there. So the departments that have this overdraft is the DSTIA, it is at 5.7 million. The Department of Education at 1.6 billion, which is the one that is driving this. And I think the issue of education has been coming for quite a number of years. And the big pressures, I know that they are part of the compensation of employees. But when I was listening to the MEC through her budget, provincial budget, if I listened properly, the initiative that I was listening about allowing the people to take early retirement, encouraging that, and financing the potential penalties when the people leave early. And if I listened also well, there's quite a couple of those that are in education. So if that projects can be managed well, I think it will start reducing the pressure around about these pressure that this department are experiencing. The other one that you have also as a bank overdraft is health, which is at 500 million, about 587. Human settlements at 3.4, as well as sports, arts, culture, and recreation. So those are the departments that have the bank overdraft. But Honorable Chair, we can always, because we do have those details, we can always provide them as part of supporting, so that by the time you meet with the departments, you know who's got what. The issue of the funds surrendered by Provincial Treasury on clean audit, okay, I've been told that these are for purely the MFMA. It was the allocation for MFMA. So when I was looking at it, Chair, and looking at the outcomes of the MFMA, how they look like. So if there's these funds that are surrendered, yes, we should be worried about the fact that something did not happen, which was planned to happen. But at the same time, maybe we need to be grateful of the fact that that did not happen, and what is the impact on the things that were supposed to be delivered. But I think I would rather say, if it's not spent, I was going to be more worried if it was spent, but there are no clean audits. And then let me just check in my handwriting sometimes also. The issue of, again, surrendering the funds from COE to goods and services at health. Yeah, I think maybe the committee needs just to interrogate that. If these funds are transferred now at a late stage, I think maybe once you got the details, you understand it better. Because you don't want the funds to be moved and then only to find out come the end of March, those funds are not spent for the right intention. But it means that maybe there's something that they could not do it throughout the year, because the where it is worrying is the issue of procurement and contract management is the event that could have happened throughout the year. So if you're transferring the funds now at the end of the year, is it because you overspent, or what was supposed to have happened throughout the year, you're only going to do it now? Because we're talking about the issue of managing the contracts, for example, that are implemented by the department. So if you didn't have the funds, does it mean that the contracts that you have throughout the year, you didn't manage them properly or not? But I think that question should be posed to the department to get more understanding. Is this issue of them misunderstanding the projects that we have to redo? Then when we appoint the contractors, we should indicate that the payments is going to be not including the VAT. So I think it was for them misunderstanding it. But I think the reason why they dispute it, they look at the extent of the amount that they need to actually recover from those suppliers, and they wanted guidance. I know that they started to engage with SARS. So I can say that I think they were more of also playing time for them up until they get more guidance of how to deal with it. And then on the one for the piggybacking on the contract with the Northern Cape, also with that one, I think we sometimes just trying to be technical about those things where you want to say, show me in the legislation, where does it say this? But these things are very clear if you think about it, that you can imagine if we can have one contractor that build the houses. I'll use again that issue of building the houses. That got the contract in the Free State to build 100 houses, and the whole country appointed the very same contractor. Where is the competitiveness in the procurement process? Are we doing these things in compliance with what the Constitution requires to ensure that there's equitable distribution and the opportunities that is provided to the different role players within that space? I know our stance is very clear. This is irregular expenditure and we are not moving with it. The only engagement that we have with National Treasury, particularly on this one of piggybacking on the contract, they were supposed to issue a national instruction note, They were supposed to issue the instruction note, which they are delaying. And the delays in issuing that instruction note is for some of the auditees hiding behind that in terms of the guidance that is not clear and so on. But those are the engagement that we have with National Treasury for them to speed up the process of the instruction note. Then the other engagement that we have with National Treasury, which I think also the committee, we need to work close to it, and I think AG is going to come up very strong on her message on Thursday, is the delays of these dispute that it takes. The guidance from National Treasury says if you had the dispute of the irregular expenditure and not disclosed, you've got only 4 months to conclude that matter and no longer have irregular expenditure under assessment, because this is how it disclosed in the financial statements. So I think we need just to get that discipline right to ensure that if the guidance says 4 months, after 4 months the investigation should have been conducted and concluded and the decision made that it is whether irregular expenditure or not. The issue of the medical claims, I agree with you, Chair, it is worrying. As I indicated also in the presentation, is that the negligence by the provincial continue to happen, because we are not investigating these cases, we are not paying where we're supposed to pay. And the worry is that at some point, the department is going to get to the point that they have to pay. And if now we are sitting at 5.7 billion, I saw on the presentation for Treasury, I think it was even giving history. You can see over a number of years how did these balances grow up of the amounts that are outstanding. And then also at the same time, if you're looking at it from the side of the patient, that patient that was not treated properly, because if you look at some of the cases, I remember there was the case that I saw many years ago where the doctors forgot to take out the scissors when they were doing the operation. And you can imagine if now we are not paying that patient, how is that patient actually survive? Maybe some of them passed away. So there's quite a lot of things that is included in that, and what happened to the dependents of those patients in the event that they passed away. So I think it's something that that the Department of Health really need to pay attention. I know there's also fraud that is in that space, where there's collusion that is taking place. Some of the health practitioners, they sell the records to the lawyers, and then the lawyers will come and claim against the department, and the department is unable to defend itself because they don't have a record. So, but it's something that it needs to be taken serious and built in proper control so that we are able to deal with these claims. The issue of the ambulances, but I think Treasury should respond. I know when we were in Cape Town yesterday, and one of the sectors that we were discussing, it was this issue of the ambulances. So I was following up with the department to say, what happened to the one ward, one ambulance? So they mentioned that I think it happened in Kharib district. But I don't think it's something that is throughout the whole province. But the conflict with that strategy is that there are norms and standards in terms of the availability of ambulance, which I think it says one ambulance for a population of 10,000 or so. Yeah. So then it conflicts now. You've got the norms and standards on this side, and then one ward to one ambulance, and then you might end up seeing yourselves that you are over-providing. And then the areas possibly that needs some ambulances, they end up having none of those. But I think the issue of ambulances, we should be looking at it in totality in terms of the norms and standards. How does the department respond in terms of the norms and standards in providing the ambulances in those areas? But what I was told, Che, is that it looks like the focus at that point, it was just in the Kharib districts and not in the other areas. So which means the other areas, they still have challenges with the availability. And then if I'm looking, there were quite a lot of other questions, but they were not directed to me. So I think I can come to the issue of the unfair procurement processes, which is in the slide, our slide 4. For us to be able to deal with the issues of the procurement issues, if we are not investigating, we are going to forever have problems, because it means that the discipline is not changing. Then they will continue to have the officials that they're not implementing following the procurement processes because they know there are no consequences that are going to be implemented against them. Then there was the issue again on the capacity of human capital in PMU units. I think that is what we notice, is that the departments that are implementing the infrastructure projects themselves, they're so reliant on the consultants. With the result that whatever they get as the payment certificate, they pay without verifying. And so which means is highly possible that the skill is lacking within the department. But also when we were engaging Provincial Treasury, I think also they can speak to it. They've got a unit that support the departments to monitor the infrastructure delivery. But they're not getting cooperation from the department, the last engagement that I have with them. So it's the discipline issue. If we can get the discipline right, we should be able to deal with this, because also when I was engaging with Treasury, they do have some resources that are able to monitor. But if the department are not availing the information to them, they recommend what needs to be attended to. They're not fixing it. As a result, we end up not improving them. Then the 7 auditees here with deficit. Okay, let me do the other ones in the meantime while you're looking for that one. The complaint by the Public Service Commission. Fortunately, when I saw them this morning, I followed up as to, because we are working on this complaint. So Public Service Commission reached out to us to say there was an anonymous caller on the National Anti-Corruption Hotline, indicating that the Free State Distia got a clean audit of MEs, did not provide the invoices to substantiate whether the funds were used for intended purposes. So we look at the matter, we reviewed our file to look at how did we get to the conclusion on this. So I was speaking to them to say, how do you want us to package the response to that? You can see that is still within 40 days. But we committed to them that we'll respond to them before the 15th of April. So what happened at Distia, if you look at the history of Distia, we've been qualifying them for a number of years on supporting the SMMEs. And at some point, we even query the classification of that expenditure, because they were putting it as transfer payments and just pay the money over and not follow the money to see it was used for intended purposes. And we query it, and then they started to reverse it and classify it as goods and services, which they recorded as an advance. And this is where the issue of the receipts starting to come in, because what they were doing, they will pay the money to the SMME as an advance, and they will recognize the fact that it was used for intended purposes, or recognize the expenditure in their financial statements on receipt of the invoice that the money was used for what it was intended for. But that did not work out because they still have SMMEs that does not provide the invoices, with the result that the money will forever lie as part of the advances and not recognized as the expenditure. And through the engagement with them, they started to implement it. They revamped the whole process of funding the SMMEs. One of the key things that they've done in their new process is where they force the SMMEs to open a separate bank account that is going to deal with the support that is provided. And the money will only be released in that bank account only through co-signatory of the official from the department. So now, if, for example, the funding was to give to the SMME to buy a car, for example, those funds will only be released to go and buy a car, and the money for them to be released, there will be a signature of the officials from the department, which make it now not necessary to need the invoice. And they change again the classification out of goods and services back to the transfer payment, which as part of the audit, we audited that, and we were comfortable that it is the best possible way. And they even develop an IT platform which is monitoring and follow through on those funds to ensure that, yes, we bought you a car, did you have the car? And that is the base that they have. So we're comfortable with that, but we are in the process of providing that response to the Public Service Commission as to how did we get to that clean audit. And then, yeah, I think it looks like all the other questions that are left, I think is for Provincial Treasury and PSC. Thanks, Honorable Chair.
Thank you very much, Honorable Chair. Honorable Chair, let me start with the last one, just to add. In addition to what has been responded to by AGSA, Chair, we also have due diligence that we undertake before the funds can be transferred. Lastly, after transferring the money, we also have M&E, wherein we follow through. So this is just the addition to what has been reported by the AGSA regarding the support that we are giving to the SMMEs. Chair, other questions I will just, because I have noted that the AGSA has really responded to. I think the first question was around the write-offs in education. Firstly, before, as AGSA has indicated, we need to investigate these three things: your unwanted, your unauthorized, which is primarily known as over expenditure. And we need to know how are we going to deal with it. Now, the issue of irregular also, you need to also know how are we going to treat it. Now, I will also club that with the question that says, do you have a plan as a Provincial Treasury to deal with this unwanted expenditure? Chairperson, yes, we do have a plan. Let me first deal with the unauthorized expenditure, which is largely over expenditure by departments. What we have done, Chairperson, we reminded the HODs or accounting officers about their responsibility in terms of Section 38. The other thing that we are doing, it's a monthly report on the expenditure by departments in a form of Section 40, wherein departments, where we see the red flags, we already highlight to department. The other thing that we have done specifically on the UIF is the implementation of cost containment measures. Now, on the side of the irregular expenditure, what we have done, we have appointed a panel of experts for those departments that are having challenges around irregular expenditure. So it's a transversal contract which covers all departments that are having irregular. So as a departure point, Chairperson and honorable members, we are already intervening in the Department of Health with regard to the irregular expenditure. We are also intervening in the Department of Agriculture as well as Social Development, or Office of the Premier as well. So it's 4 departments where we are also intervening regarding the irregular expenditure. So Chairperson, out of this exercise, you will recall that the outcome could be write-off or recover. So that is irregular expenditure. Now, on the issue relating to fruitless and wasteful expenditure, there's a strong linkage between unauthorized expenditure and fruitless and wasteful expenditure. Let me articulate, Chairperson. Bulk of our fruitless and wasteful expenditure comes from the interest that would be charged because of non-payment, including the third parties. So once, if we can deal with the issue relating to unauthorized expenditure, largely you would have dealt with fruitless and wasteful, because that is where it comes from. So that covers the issue around the plan that we have and the issues relating to the write-offs. Chairperson, I want to agree with the AGSA. I think here, I'm sure Odwa was just copying me. The issues around on medical legal claims, there's issue around negligency, there's issue around evidence files are missing. There's also issue that the colleagues are colliding with the lawyers with a view of maybe milking the department. But what is it that the sector is doing? There is a sector-specific plan around medical legal claims. So I would also agree with him that perhaps department should come and present the sector-specific plan around how are we going to deal with issues relating to medical legal claims. Chairperson, on the infrastructure, where it was also indicated that it looks like departments do not undertake feasibility studies, they don't look at the needs. Chair, I think generally when we firstly look at the plans that we have or the tools, we have IDMS, which is known as Infrastructure Delivery Management System, which is a tool that we are advocating that all departments should actually utilize it. This tool, it has different gates, starting from planning, execution, up until the evaluation. So we are taking an advantage of this, training most of the departments around it, and we are now forcing them to report on monthly basis in the infrastructure reporting model. It is true what AGSA is saying. There are still gaps in terms of the information provided by the department, especially the completeness and accuracy. But what we are currently doing, Chairperson, we have tried to force that bulk of the money be budgeted on maintenance and rehabilitation, such that we don't build things that we don't need. We have discouraged the departments to continue with identification of new facilities, because we have noted that maintenance is being neglected, so hence bulk of the money is budgeted under maintenance and rehabilitations and upgrades. Chairperson, just on one issue that I would like to make a distinction. I think it's on the overdraft. I know we're using modified cash standard, but in terms of cash in the bank, if I can call it, generally we only have one department that has a bigger problem, which is education. But there's a book overdraft, if I can use that word in that order, where most of the department that the AGSA has mentioned. But if you physically go to the bank account of departments, even now, we know it's education. I think in the past, PRT was also part of those that had a problem with the bank overdraft. So I think I wanted us to maybe make that distinction between the cash in the bank, wherein there's that smallanyana difference between us and AGSA. Chair, I think I don't want to repeat. Let me also Oh yeah, there was issue around the health, where they took money from COE to goods and services. Chairperson, allow me to explain it in this fashion. Firstly, we received money from National during the adjustment budget. But this money, which was meant for appointment of people, there was small challenge. The money did not have a carry-through effect. Now, if you don't have carry-through effect over the MTF, you are running a risk. That was the first thing. The National only communicated the carry-through effect very late, but that affected the department in terms of planning, in terms of appointing those people. But at the very same time, Chairperson, health is one department with one of the highest accruals. So I think from the side of Provincial Treasury, we thought that maybe it is important that they also deal with issues relating to accruals. We know the money was meant for compensation of employees, but if they don't have appointment as yet, that money was then utilized to address some of their pressures. But we know that there's a need for nurses, there's a need for specialists, there's a need for doctors. But I think it was going to be very risky, Chairperson, to appoint people permanently if you don't have a carry-through effect at that time. But now that problem has been resolved. Health cannot say we cannot appoint because there is a carry-through effect in terms of the allocation letter that we have issued for the MTEF, Chairperson. Chair, let me, on the 15 million, I think we need to acknowledge that the money was supposed to be used for clean audit on the side of Provincial Treasury, primarily in the last audit that has just ended for the municipalities. But I believe, Chairperson, that there's still an opportunity, especially looking at the financial years for municipalities as well as the department. Although we did not utilize all the money, but there are certain strides that we have made, as we have previously reported, that we have appointed the financial experts, though we appointed them slightly late after the closure of the finalization of the audit for municipalities. But we believe with this financial year that is going to end now in June, we would be able to make much needed difference, Chairperson. One, as I've indicated, we have the UIF-NW panel that we have concluded now on the 13th of March, which will really assist. It is purely dedicated for municipalities. So we believe that that would assist in terms of reduction of UIF-NW on the side of the municipalities. We also have these warm bodies, Treasury, that would assist in terms of looking at the audit action plan for these municipalities. So we believe that there would be some value add in this financial year that is to end. Although we are acknowledging that in terms of the previous audit, we have really lost a Chairperson. So, Chairperson, let me pause there.
Thank you, Chair. I just want to add 3 things before we move to Public Service Commission. The first one is on the dispute of human settlements in terms of the VAT issue. It's not an isolated issue just for the Free State, so there's other provinces that had the same interpretation as Free State, so that is why it was escalated to SARS and to National Treasury. So it's not just isolated to our province. And then in terms of the measures that we had put in place, I see our member has walked out now, but from Program 3 side on the SEM accounting, I am now responding to you. On the side of supply chain management, accounting officers, before they actually appoint a contract to a service provider, they can send that tender to Provincial Treasury. Provincial Treasury will do all the steps to see if everything was followed according to the book. From the advertisement, the bid specification committee, bid evaluation and adjudication committee, then we will issue a report to the department to say either the processes that was followed is correct, you can award the tender, or we have these shortcomings. So that is available at Provincial Treasury. It's not compulsory, so accounting officers can elect if they want to send it to Provincial Treasury or not. And then in terms of the last one, it was the evaluation of the APP's performance information, all that information. That responsibility solely lies with the Office of the Premier. So Provincial Treasury is not monitoring the APP's or performance information at all. Yeah, departments, nothing. Yes. So that responsibility for the departments is with Office of the Premier. Thank you, Chair.
You know the problem with Treasury. We last week or 2 weeks ago, I don't remember when was that, we indicated to them. But they have answers that departments don't have. Same questions, specific to the department. The department does not have an answer, but Treasury has an answer. So either the Treasury has taken the responsibility of departments, and the department does not know why it's underperforming on a specific area. It's only a Treasury that understands why it's underperforming or it's not doing the right thing. I just wanted to indicate that it's the answers that we get, it's what we don't get from departments. And they were seated here. One of the questions on Friday to Rose was in terms of projections on revenue. You don't have speed cameras. Can you give us, just quantify what you lost during the festive season and what you are going to lose now during Easter period? They did not have answers. But Treasury might have answers. And now, when we ask, okay, in terms of projected revenue, what is it based on? Because this thing that gives you revenue is not working. Why do you then say you have that type of projected revenue? They did not have answers. They just said, you must understand cameras are a crime prevention, not revenue enhancing mechanism. But Treasury may have answers that Rose does not have.
Thank you, Chair. I think this platform really, it's a good one because it flags out the issues that have been silent for quite a while. You would know, Chair, that the Public Service Commission, amongst other things, has got a mandate to monitor and advise on the public administration practices. So we have been listening carefully in terms of the contributions from other colleagues, and there are issues that we think will take them up with them beyond this platform. I must basically point out from the beginning that I'll just touch base on the broader aspects that affect the PSC, and my colleague will go to the nitty-gritties with regard to the specificities of questions raised. The PSC bill that has been adopted by the NCOP is one of the attempts to implement the objectives of the National Development Plan in terms of ensuring that the PSC becomes much more effective with regard to ensuring the pursuance of a developmental state in terms of capacity, ethics, and so on, that we all know. And one of the constraints that is faced by the PSC, amongst others, is pertaining to the finances. In other words, in terms of our finances, we are constrained. You would be aware that the AG, as they do their work, they charge fees. And so they are self-sustainable. With us, it's not like that. Because of the legacy issues where the PSC has been housed under a department when it is actually an oversight body, constitutional body. So that has been remedied through the PSC bill. And that is why in Chapter 10 of the Constitution, the mandate of the PSC with regard to all spheres of government is clear, which includes local government. And also that would be addressed, it is rather addressed in the PSC bill. So all these issues affect our operations. We are understaffed, both at national and in their provincial offices. So with regard to, for example, the rules that govern our management of cases, it will become more specific, but there are rules that guide us. For example, to say within this particular period, we should have completed an investigation pertaining to either a grievance or a complaint in the public administration, but he will speak to that. But I must just say why I'm raising that some of the complaints that we receive have prescribed, and a lot of people, because they do not know that, for example, if a matter is prescribed, there must be exceptional circumstances that may actually persuade the PSC to entertain the matter. We sometimes receive cases from as far back as 7 years, 3 years, and so on. And when actually the mandate says within 12 months you can entertain such. So I'm just citing an example. But also the decisions of the PSC are binding on the department's chair. And that has been also tested to the Constitutional Court. So whether it's an advice, whether it's a recommendation, whether it's a directive that is within our mandate, if a department or the executive authority or HOD, any of those structures is not happy with the decision, they have to take that on review through the courts. But what we have observed is that most of agencies in government, including, senior managers, do not appreciate the current structure of government as a constitutional democracy. And as a result, you do have a lot of lacks with regard to implementation, respecting the rule of law, and ensuring that, we move without really impeding on mandates of other structures. A good example that the AG has raised is pertaining to the health issues. That is directly linked to the National Development Plan objectives, and specifically how the NHI is going to be implemented. We've done a lot of work in health, and we have observed that a lot of issues are not being understood, or there's no appetite, or maybe it's ignorance, but I am glad that Treasury has indicated that they are now going to be employing, amongst other things, medical professionals, because that has been an area. But in a nutshell, we do have rules that govern our engagements pertaining to issues, and the provincial director, the PD, will speak to that. But in everything that we are doing, We want to promote the constitutional values and principles. But we must emphasize that is not the spirit. I think the Deputy Speaker alluded to the reluctance, lack of appetite to implement decisions that we all know that are binding on our agencies. And that loathness, it is really bothering. And we sometimes do not realize that, you know, these agencies, they wield authority that is independent, and their decisions really could sometimes take us to where we have not imagined they would. So we are appealing to the committee to really ensure that as we exercise this constitutional oversight, we do have support from the relevant structure of the legislature in this regard. Thank you, Chair. I would ask Mr. Mlisana to go to the specifics.
Thanks, Commissioner. To respond to the specific questions raised on the issue of ambulances, I think the AG has responded, and I think the response is sufficient. Our study was also based on the understanding that in terms of norms and standards, there's one ambulance per population of 10,000 people. And it was focusing on one region, the Thaba Mofokeng region, and it came to the finding that 45 ambulances were needed. And as we were conducting the study, we didn't pick up any, because we did ask, because we knew about the slogan, one ward, one ambulance. But no one knew anything about one ward, one ambulance. But we're expecting a feedback in terms of progress from the department. We have posed those questions in our report, and hopefully we will receive that feedback sooner. In terms of the National Anti-Corruption Hotline cases, in terms of the toolkit, the guidelines in handling these cases, there are 40 working days given to a department to either investigate or respond to the PSC. After 40 days, we expect the department to have at least done some work and to be able to respond. Whether it's work in progress response, that they are still dealing with the matter, or whether they have finalized the matter. But in 40 days, we expect the department to respond. And those cases which are indicated, 40 days have not expired, are cases we received relatively this year, in January and February. So the 40 days that we count has not expired. Those that were received and referred last year in 2025, the 40 days is expired. So we're expecting feedback which we have not received. And in 40 days intervals, we do follow-ups with the specific departments. Yes, some indicate that because this referral is done through the office of the DG of the province. Some will indicate that no, we didn't receive this from the DG. So through the follow-ups, we are able then to bring these matters to their attention. So we do follow-ups, but we honestly we're struggling. It looks like departments themselves do not have the capacity to follow up on these matters and investigate. So they forever investigate issues, and it takes long, and because there's an anomaly in our democracy, the PSC was given a mandate without capacity. Some of these things get overtaken by other events because we don't have capacity. Issues that happen in 2022, 2023 get overtaken by issues that are happening in 2024, 2025, and it's difficult for the PSC to keep track of those matters that are outstanding, which happened in 2022, 2023, because of lack of capacity. But we do follow up, and we've got timelines in terms of our investigations. We must follow up within it's a normal investigation which we conduct ourselves in terms of what they've done about the findings of the PSC. So the timelines are provided in our guidelines and systems. Of course, if there's no feedback, as I've indicated, we do follow up. But the PSC is also empowered to summons officials, HODs and EAs. It's a provision that the PSC has not used greatly in the past to summons, but it's a last resort. It's a last option. When everything else has failed, the PSC is empowered to summons officials up to the level of the executive authority. It's something that the Commission must perhaps consider doing it more often in cases of non-compliance and non-provision of feedback. The issue of, there was a question about can a salary be stopped or cut when to enforce accountability. It's not possible to cut a salary or stop a salary of an employee unless you do it by implementing interventions such as suspension without pay. For instance, where there's an act of misconduct or act of poor performance, act of negligence, and has not performed a particular task because the person was negligent, or the person issues of attitude and so on, then out of the investigations, then there could be a sanction that stops the salary of a person for a period of 2 months or so. So that's the only way you can then implement a non-payment of a salary or on and not competent. Therefore, the government, that particular department or your employer must make sure that you get coached and trained, and so that you become competent. It could be because you are suffering from health issues, incapacity. Then health managers must look into that. And if you are permanently injured, then you are taken out of the system because you cannot perform. It could be other issues as well, issues of just poor performance or issues of misconduct. So it depends what's the nature of the problem. The issue of the AG, the complaint, I think Mr. Duda has dealt with that. I think those were the specific questions, Commissioner, that I had to deal with. Thanks.
Thanks, honorable members. I think what the report of the presentation of AG is complemented by that of Treasury raises the issues that we have raised with government. We're saying planning versus resource allocation. I think it talks to what is being said, that the Office of the Premier is not doing enough in terms of dealing with the departments on the issue of APPs. And every department, when it comes here, they want this committee to assist them to get more on that one and give it to you. And when this one also comes, he wants more money, it means it must be taken from another one. Also, one of the issues that we also observed was that at some point dealing with challenges, shortcuts have been taken without clear explanation. I mean, in one instance, we were told that in order to address the COE problems in roads and transport. Employees are being shifted to social development. And then when we asked, is that problem that we take to social development now not going to be the problem of social development? Because social development also needs social workers in terms of the issues that are coming up. We then raised an issue that clearly from Executive Council, there are no government priorities. Because once government has priorities, it then has plan. If people are then able to go to budget lekgotla, that's where they must be concretizing governmental plans. And there must be an understanding on why is this money taken from here to there. Now, what we are also raising on this, in a period of 2 months, you have 3 adjustments. The last one was just supposed to have dealt with the issue of people going on this early retirement. But you still had a shifting of funds. It clearly says to you, there are problems of planning. It then would remind you of a situation of what used to be rife and that where at the beginning of the financial year, departments are planning. And as they are planning, some of the items, that's where money is parked through adjustment. And as a pressing a need, no, we should take from here because there's a pressing need there. It was a plan from the beginning of the financial year. But because it will then have to be used in a certain way, it will then be parked under a certain item. So it's part of the issues that we then say we really have observed, especially on the issue of cooperative governance, which then led us to an issue of saying, as a committee, we have not dealt with one district plans, which are supposed to be adopted by provincial executive council, so that they then become provincial district one plans. And that will then show coordination that is as we are interacting with departments in terms of the plans. And part of the issues that you flag out in the report, Reader Park Clinic, we have dealt with those as we are interacting with the department. But the issues that we could get, it's different from what would be written here. So that's why we are then saying we really don't understand. Maybe the problem that we have is the political system. Because if we had political systems that, well, depending on your own the political views, which we may say are autocratic, this is where you don't see things like this. Now you have to establish a lot of committees. We have to have a committee of experts to deal with this and that. And those committee of experts are having the same qualifications as these people who are dealing with those things in their own portfolios. Now, it's one of the issues which comes up as an opening where funds that are meant for service delivery now have to go towards, because now they have to address these issues. But also whether those things that are being established, whether ultimately, when you do monitoring and review, whether they were impactful, it's one other issue that puts a question mark. The same way as it has been raised that audit committees are not impactful. As we were dealing with local government, MFMA, why we decided to have audit committees of municipalities was basically because of that, to see what is the role and the impact of the audit committees in municipalities. Maybe it's also one of the lines that we also have to take when we deal with PFMA, so that we can really understand how are they being treated, what is it that they are doing. And it was also through that in some municipalities we found that municipality has not been issues that were coming from internal audit were not tabled anywhere. I think, I wanted to close and give order over to, maybe you can, okay.
Thank you, Chair.
Maybe that becomes the last question, so that
Yes.
we then give over to the MEC. We have been keeping you here. You are now a member of the committee.
Member of ProPEC. Yeah, Chair. Thank you, Chair. I think the reason why we raise the issues of why does an official who underperforms continues to receive salary as it is. One, there are, let's say a certain chief director is responsible for building houses. I'll make an example. And in terms of that, he has 90 million to spend and he has 90 targets. But the situation arises that he finishes the 90 million, but in terms of targets, he only achieved 40. This person has signed a performance agreement. This person does annually PDMS. And where he has performed, he gets increment. I'm not sure now what it is. It used to be mine. But when he has underperformed, he does not get to be docked salary or to be docked whatever amount that is supposed to be. So majority of the cases of PSC from 2023, 2024, 2025, they are based on salaries and PDMS issues. So what we want to understand, and the Basic Employment Conditions Act does allow that an employee must be, a salary must be deducted, but up until 25%. So it's not true what the PSC is telling us, Chair. But how it's done, it must be done legally. And in legal, it means that there must be it must be written. It must not be done unilaterally, meaning that an HOD or an executive authority cannot do it unilaterally. But a performance agreement is a tool that is used. So given that you have this number of complaints that comes on salaries and PDMS and so forth, it is possible that a person that as an official that has underperformed to be deducted a salary because he or she has signed a performance agreement. But this is something that you should look into it. And I think it's something that we're going to take it through with the other departments that are going to come, to say that the Act does allow, but this person is not, and if that person is supposed to build those houses, he achieved 45, not 90, but he finished the budget, and then the people are not getting those houses. 45 is not getting those houses. And the explanation is that the contractor delayed or there was whatever reasons that might be persuaded. What we stand for as the legislature, we stand on what is due to the people must get to the people. The person that does not deliver must face the consequences. It does not matter, its suspension is what. But if it does not warrant a suspension, why are you paying that person full salary when he did not account and deliver on what they are supposed to do, what they said they are going to do? Because the targets, they are set by themselves. They are not set by anyone else from nowhere, and you hold them accountable on what they have said. So this is something that we think that PSC must also look into. As far as I would not know the nature of PDMS issues that came to you, what are those complaints? Secondly, perhaps Chair, if they can give us in writing, we want to understand that you receive a complaint. You receive a complaint on the, I'll take an example, because I asked this question, but it's not coming clear as to where is the delay, because we understand that you refer the issues to the office of the DE. You receive a complaint on the 28th of January. Then on the 11th of February, that's when you do a referral. Approximately a week or two, some others, they are 4 weeks, some others. What is the cause of the delay? That makes you, because now you have 40 days. If a person that, because the people that are disadvantaged, it's people who late complaints now. Because you are sitting with a complaint for 3 weeks or 4 weeks or a month. So we want to understand what is that issue that caused a delay for you. If you receive an email today, you register it, tomorrow you disperse it. Why does it say to sit 3 to 4 weeks or a month with what do you call PSC? Those are the issues that I want to raise. Thank you, Chair.
Thank you so much, Honorable Skwebela. And now we can give over to the MEC to give us a closing remark.
Thank you, Honorable Chair and members of the committee, a representative from the AGSA and the Public Service Commission. I really want firstly to thank you for affording us the opportunity to be here with the Chapter 10 institutions, and I don't really regret being here. I learned a lot of things that they really needs to be done. And I think also for affording us the opportunity to also share with the committees on some of the things that we really think that they are very much important for this. Let me also assure the Public Service Commission and the AGSA that we are open to any engagements, and we really appreciate the work that they are doing. The committee, I think for some times now, they know that every time I come here, I always tell them that accountability is the cornerstone of democracy. And it also ensures that we service our people very efficiently, and we are actually held accountable to ensure that every cent that is intended to spend on the public out there, it's really done so. So we really appreciate the work that the Public Service Commission and the AGSA, they are doing. Actually, I was sharing with the one rep of the Public Service Commission that part of what they are doing help us also, because some of the things that they are raising, they also have some financial implications, because you will find that an issue that they are raising has a financial loss to a department, and something that we could have avoided. I mean, if you are, I was making one example, if you are to advertise for vacant positions, and you decide as either the accounting officer or ourselves as the executive authority not to fill the positions and ask for re-advertisement again, already that department is running at a loss. So it's very much important that Public Service Commission also pick up on those things so that we are able, when we do our oversight as the Treasury, to help this thing. But let me also just highlight some of the things which are of a concern to me that have been raised here, and maybe some just as a response. You know, when this country was built, the democratic breakthrough, the provinces were just add-on because the negotiators at that time wanted to build one country, but they came up with provinces as a compromise. But the main vision is that we are building one South Africa. So it is difficult for any one of us, anywhere, to think that because someone is from Gauteng, should not get services from Free State, particularly because we are talking about basic services. One question that we must always ask ourselves, how many Free Staters who are also enjoying such services in other provinces? Whether they be health, whether it's water, whether it's electricity, I think there are many. Because our people, because of unemployment, they have their own internal immigration routine that they always take. So I will definitely appeal to members that there's no way that we can make such a rule. It would be unconstitutional. It would be against the constitution of this country. And the constitution of this country is based on building one country. So provinces are actually the building blocks of that country. The other thing that which I will want to share with the committee and the AGSA and Public Service Commission, it is this one of departments asking for money, but there are no checks and balances from our side. So we're moving forward as the Provincial Treasury. I've said to colleagues, we must just look at the laws if they are going to allow us. But I think we're trying to say to them, if you are to come and say, we want this much, there has to be some conditions that you must pass through. But also look at your own status. And one of the areas that we are targeting is the UIFW. About 100,000 or 200,000, can we look at your UIFW? And how far are you working as a department to recruit that money? Because it could be you are looking for money, but there's money in your department. The only thing is that you are not making people to account. There are no consequence management, which is what I think one honorable member was raising here, that there seems to be lawlessness in relation to how UIFW is inclining. So we've then come up with this thing that in future, colleagues need to tell us, what is your audit action plan? What are you doing? Because some of the things, the auditors will advise us that if you are to do 1, 2, 3, you will be able to make savings. You know, I was making one argument with the municipalities. The UIFW of municipalities is seated at plus or minus 23 billion. And I was saying to them, combine that 23 billion. If it was money that we were saving, each municipality will have allocated it to 1 billion. Just to look at the services. You know, just think of Machabeng, Okwale Mahlo, Ore, they've got 1 billion with the needs that they have now. But there's money that is seated there in a form of UIFW around. So when they ask money in future, don't be surprised when they come here and complain that Treasury does not support them. We will support them, but we also want to see if they are taking action. Because that's another form of support, accountability, to ensure that they do that. So the finance bill since 2018, it gives which was presented to the Provincial Treasury, the draft recommendation to ESCO, but the challenge is that the provincial cannot afford. The ProPEC in 2022 did not take the resolution as well. So these are some of the things that we really need to look at them. That here is the bill, what do we do with the bill, and the decisions that have been taken by ProPEC, because we really appreciate the work that you are doing. It's a lot of work that you are doing, and it needs to be supported. And departments must come here, not to fight, but to ensure that they respond positively to the issues that have been raised. One question that has been raised by, or a concern, although it was on a lighter note, that there seems to be more answers in Treasury than other. It is because we are playing our oversight role, number one. But number two, I always encourage colleagues that we really need to follow the sense. And the only way we can follow the sense is also to understand why are other people not doing their responsibilities. And that's how we are empowered to understand, okay, this department is responsible for enhancing revenue, but what they are doing or what they are not doing, it's actually hampering their work. This department has a challenge with COEs. What could have been the problem? What would have been the cause? So we are able to get deeper than any other department, and that has helped us a lot to understand. I think where the PROPEC maybe needs to say to us or advise us is to say, can you have maybe a platform where you share these things with them? And I will tell you, we have such platforms. We have begun to have such platforms. We have begun, and I'm so excited that the Premier is also submitting herself to such committees or such platforms where they come and we look at the status of the finances of each department. But we are going to continue to do it. All what we need is for you to emphasize that role to them, that it can't be that it be the Treasury that gives you answers, but you are unable to give same answers which you are expecting from you, and you are the implementing departments or the primary departments that is working with that sector. So it's very much important that we really need to do that. So we have also invited researchers from legislature to help us also to get to the bottom of other things. I think the issue of the financial aspects have also been alluded to. Really, we appointed them very late, just towards the end of the audit financial year. But the fact of the matter is that they will be also looking on financial statements. They will also be looking at the records. One problem with municipalities and some of the departments, there seems to be, I don't know whether it's a practice or what, but they don't keep records. You will ask them questions here and say, do we have records? I mean, the AG, they always share with us that. They will tell you that we've got this project has been implemented, but there's no supporting documents. And this is where AG has a serious problem with most of municipalities and some of the departments. So we're trying to strengthen up and to ensure that in future, as and when they are asking for money, support and everything, we also look at all those things. But thanks very much. I'm very much excited about this platform. I wish that in future maybe some of my colleagues can just come and stay there and listen to look at themselves at the mirror, that this is how we look like. Thank you.
Thank you, MEC. Thank you, Dodo and the team. Thank you, Tolo and the team. I think now we adjourn for lunch. You are invited. I know there's an MEC, Toto Makume, is very hungry. When you talk about food, he'll jump. But he's not number one. There are those that top him. Please join us for lunch, ladies and gentlemen.